Again, I think it's just so tragic how our healthcare system is racist. If you look at the number of people in our state that are covered by Medicaid, in California, we call it the Medi-Cal service. The reimbursement for Medi-Cal is 47th, meaning out of 50 states, our state pays the third lowest to doctors. And as a result, so few doctors will see Medi-Cal patients. And Medi-Cal patients, as a result, because there's so few, have to wait months to go see a doctor. The LA Times did a story about how many people had to wait. Some people had to wait over a year to get the proper surgery they needed. And if you look at the number of people who are on Medi-Cal in our state, it's disproportionately people of color. In fact, MALDEF, the Mexican American Legal Defense Fund, is suing the state of California, claiming that it's a separate apartheid system. It is, it's separate and unequal. And a judge finally allowed it to move forward. And yet you have all of these Democratic members of the Assembly and Senate each year. What they try to do is, let's just expand Medicaid. And what they say is, and then they go back to their neighborhoods. We expanded Medicaid to cover our undocumented people 55 and older, or our undocumented children. But what they've done is they've just poured more people into a system without increasing the coverage and increasing the reimbursement, so you don't get more doctors to take care of these people. So you've added an extra 10, 15,000 people into the system, which has only caused further delay in people getting the care they need. If they were really concerned about the communities they represent, they would fight for a single payer system where instead of giving everyone Medicaid, they would give everyone the best private and best insurance. We would all be equal. We would all have the highest quality insurance, that we could go anywhere. We wouldn't have to experience the delays, and any doctor would gladly see us because of the coverage that we had. But this is our racist system that we have right now. And as you pointed out, David, sickle cell anemia primarily is a disease that affects, it's really only a disease that affects our Black community. And yet the amount of funding that goes into that is so paltry compared to cystic fibrosis, which affects so few, but traditionally the kids tend to be white. I think rather than have us all fight over crumbs, there's enough at the table that we should just take back. The amount of money we spend on military defense, the amount of money we spend on subsidies to the oil and gas industry to this day. Here in the state of California, we have not had an oil extraction tax ever. Now I know people don't want to do that now because they think it just will increase drilling and increase. But for the last 20, 30 years, where this state has become the third largest energy producer in the country, it would have been nice to be able to tax that and give that revenue back to citizens. Up to a few years ago, citizens in Alaska were getting a dividend every year from their oil extraction tax, and they had Sarah Palin as governor, right? And we don't do anything like that. But our healthcare system is desperately broken. I think we have a ticking time bomb. Many of the seniors on this call are experiencing that, I'm sure, either themselves or with a loved one, trying to find out how to care for them. My father-in-law, he was in assisted living for a year. We thought he was going through some early dementia. And the costs that we had to pay out of pocket, we were fortunate enough to be able to afford that, but I just shuddered to think how others were able to do that. Either they had to quit their jobs to stay home to care for them, or just watch their ailing loved one deteriorate without any care. And we can do better as a society, and that's what we deserve to do.